Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about x-raying your knee if you're months or years out from surgery because you're still having pain or other symptoms, and that x-ray turns out to be normal. What's the next steps, and why are you still having this pain and symptoms? Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So, there's a couple different reasons why you might want to get an x-ray of your knee if you are many months or a few years or more out from your knee replacement surgery. And usually that's because you're having pain or maybe some other symptoms. So probably the number one thing is continued pain or a new onset of pain in and around the knee. Other reasons may be for new onset of swelling or continued swelling, stiffness. You may also feel some buckling or unsteadiness or instability through your knee joint and your legs. Or you may notice some other symptoms such as redness, swelling, warmth, things that might be indications of an infection. So for one of these reasons, you may want to see your doctor and have a follow-up and a consultation and kind of see what's going on. Why am I still having pain? Why am I still having these symptoms? And very often they'll do an x-ray. And what happens is sometimes that x-ray will come up positive, that there's something going on. Maybe you had a fracture, a broken bone nearby or within the prosthetic, attached to the prosthetic, or you may have some loosening or some decreased integrity of your prosthetic. But actually for a lot of folks, they may find that the x-ray looks completely normal. The prosthetic looks good, there's no indication of a fracture or a broken bone. So what exactly is going on? Well, it's really comes down to there's a lot of different factors that play a role in your pain and in your symptoms. So first off, we want to talk about having realistic expectations after surgery. It's very uncommon to be absolutely pain and symptom free after knee replacement surgery. We hope that your pain is greatly reduced in frequency and intensity. We also hope that the stiffness and the swelling and any other symptoms you might be having are greatly reduced. But it's still very, very normal to have a little bit of lingering symptoms that kind of show their ugly face, maybe first thing in the morning or after a day where you're on your feet and doing a lot of activity, things like that. It's still normal to have some symptoms after knee replacement surgery. So first we want to look at making sure we have realistic expectations that some pain, some symptoms, though shouldn't be of the same intensity or worse intensity, but having some still is not abnormal after knee replacement surgery. What we also want to think about is if the prosthetic, the knee itself, may be good, but we want to look at all the structures around the knee joint. So there's lots of soft tissue. There's muscles, there's the tendons or the end of the muscles where they attach to the bone. There's ligaments that are attaching the different pieces of the bone and providing stability at the knee joint. There's nerve function and nerves traveling through your legs and around your muscles and around your knee. So we want to look at potentially, are any of these things something that we can address and look at? And the best way to do that is really to consult with your doctor, to consult with a physical therapist. Let's look at your impairments. Let's look at your range of motion. Do you have adequate range of motion? Is there any potential with consistent exercise and range of motion activities we can get a little bit more range of motion, help address some of that stiffness? Is there muscle weakness that we have to address? Do we have to work on a strengthening routine to continue to build up the strength in your quadriceps and your hamstrings, your calf muscles, your hip muscles to help offload some of that stress through your knee joint? Do we have to look at your movements, how you're walking, what your walking pattern is, what your pattern you use when you're going up and down stairs or getting up from a chair, or when you're exercising and doing whatever you like to do for exercise and physical activity? Are there things we can do to modify that, work on your mechanics a little bit, work on how you perform those activities to help relieve that pain and discomfort? So those are probably the first things that you're going to look at, is having realistic expectations and then looking at if there's anything we can address in terms of impairments, in terms of strength, range of motion, movement patterns, balance and stability is another big thing, things of that nature. And then you also just have to understand that when you've had pain for a prolonged period of time, a number of months or years or more, that becomes a different animal than acute short-term pain. This becomes persistent pain, or you may hear it referred to as chronic pain. And really, this is a much different thing to manage effectively and appropriately. In many instances, people with persistent pain, they don't have any significant or noteworthy structural impairments or structural deficits in their bones and their prosthetic, or even in their muscles and flexibility and strength. But they still have this persistent pain. And I don't want to get too much into the weeds because there's a lot you can talk about persistent pain and the strategies to address that and deal with that. But you have to understand that it's very complicated. There's a lot of different factors that play a role in your pain, especially the persistent pain type. This includes things like other medical conditions you might have. Maybe you're someone with diabetes. Maybe you're someone who is obese. Maybe you have peripheral neuropathy. Maybe you have a history of cancer or osteoporosis or osteoarthritis to a significant extent throughout other parts of your body. There's many other possible comorbidities that can be playing a role. We also want to look at again, we talked about expectations, but we want to talk about the past history. Have you had injuries in your knees or legs or back before? Are you a sedentary individual throughout your life, in adult life, in childhood? Are you active? Are you tremendously active? Are you an ultra marathoner? Are you somewhere in the middle? These things are all going to impact your persistent pain. We also want to look at your mental health. Are you dealing with anxiety, depression, excessive amounts of stress in your family, work, life? Definitely big role players in persistent pain and dealing with pain and symptoms effectively. So there's all sorts of different factors to consider. Other things, are you getting adequate sleep at night? Are you eating a healthy diet? Are you just managing your mental health? We talked about that one already. And I'm sure there's other things that I'm not thinking of right now. So what do you do with all that information? Well, the thing is, one, if you've had the x-ray of your knee and the surgeon has told you, hey, it looks good, there's nothing wrong with your prosthetic, then feel good about that. Know that I can trust my knee, there's nothing wrong integrity-wise, and I can trust it and I can try to use it to be physically active and to do the things that I want to do. Now, you may still be having this pain or these symptoms, but understand this is your body's alarm system. This is your body trying to protect itself, and it's kind of gotten out of whack because you've had this pain for so long. So now you have to kind of relearn or reteach your nervous system, your body, how to move and how to do things without setting off that alarm system. And the easiest way to do that is just starting physical activity. Start from a very small amount, very small, very easy amount, and just kind of build up gradually. It can be easy as walking a little bit, and then walking a little bit more as you get comfortable and build up confidence. It could be swimming or aquatic exercise. It could be using exercise equipment in a gym. It could be something that's not really exercise, just physical activity, gardening, hiking, all sorts of different options out there. The best exercise that you can do is the exercise that you're going to enjoy and be able to do consistently. Now, what are you going to do if you have pain during these things? Well, a little bit of pain, a little bit of stiffness and discomfort, the majority of times that's okay to work through it a little bit. I always give my patients the recommendation, if the pain is about 3 out of 10 or 4 out of 10, that's kind of the borderline. So anything less than that in terms of intensity or pain or symptoms, it's okay to kind of keep doing what you're doing, continue to work through it a little bit. If you start getting to that 4 out of 10 pain or a little bit higher, that's kind of telling your body that, okay, I either have to modify what I'm doing so this pain doesn't get any worse or goes down, or I might have to stop and rest for today and maybe try again in a day or two. So really using pain and stiffness and symptoms as your guide, not avoiding it completely, but also finding that happy balance where we're continuing to stay active, we're continuing to retrain your body and your system, but we aren't overdoing it where you're going to have an exacerbation of symptoms or maybe referred to as a flare-up of symptoms. So really, it's a different mindset when it comes to dealing with this persistent pain. Again, remember that x-ray, if you had that x-ray already and it shows that your prosthetic looks good, then be encouraged by that. Use that to build confidence that you can be physically active, you can do the activities that you want to do. You just have to start to listen to your body a little bit and find that happy medium over time. And a really great resource to help you with this, of course, is any physical therapist, an occupational therapist, or a knowledgeable personal trainer who you trust well, or athletic trainer even. There's lots of professionals and people out there who are comfortable and familiar with post-rehab individuals, people dealing with persistent pain, who can help get you set up on a plan that is successful and appropriate for you. So again, if you're continuing to have pain or symptoms, don't be discouraged. Even if that x-ray looks good, there's still steps and things that we can do to address the pain and symptoms and get you feeling better and moving better and doing the things that you enjoy. I hope you found this video helpful, insightful. Please again be sure to hit that subscribe button. Please be sure to hit that like button if you did find this helpful, to help share this video. And of course, leave your questions, your comments below. I get back to everyone I see in due time. Thank you very much for watching.